Riverside Shore Memorial Hospital is a 52-bed hospital, part of the Riverside Health System, that serves the Eastern Shore of Virginia, which is a population of approximately 45,000 people. We have significant socioeconomic barriers here. And in addition to that, our patient population has significant medical needs. Compounding the problem is the fact that we are also geographically isolated to some degree, in that we are separated from the rest of Virginia by the Chesapeake Bay, and to access that area requires traveling over a bridge tunnel 18 miles, which also has a toll that has to be paid. 340B community pharmacy partnerships are extremely helpful for our patients in this community. Specifically, it allows them to stay close to home where they can receive their medications, obtain their medications, and ultimately that improves their adherence to their medical regimen. It improves well-being, prevents exacerbations of the disease process. They do much better in the long term. When drug companies recently restricted 340B discounts to our hospital, it really had an adverse effect on a number of my patients. I'll give you a specific example. I have a patient with COPD, and because of his being underinsured, he is unable to afford the basic maintenance inhalers that he needs, specifically 2 separate inhalers. Due to the restriction, he was unable to obtain one of those medications that he'd previously been on, which allowed for great control. And as a result, he had increasing symptoms of shortness of breath, wheezing. He required additional office visits. We had to supplement his medications with other medications that had increasing side effects and were not as effective for him. If the drug companies continue to restrict 340B discounts, I'm extremely concerned of what will happen with patient care. I feel certain that patients that have relied on these discounts to obtain the most basic of medications for whatever disease process they have, they won't have access to it. Specifically with the COPD patients that I take care of, this will result in increasing emergency department visits and most likely hospitalizations. So, the access to the 340B discount program is really essential.